Have you ever wondered if AI could revolutionize how we fight cancer? Well, something huge is happening right now in the UK that could change the game for thousands of men. The NHS is launching a massive 3-year trial to test a new artificial intelligence tool. Designed to tackle prostate cancer head-on, this isn't just a small experiment. It's a £1.9 million study, funded by Prostate Cancer UK and led by the brilliant minds at the University of Oxford. So, what does this AI tool actually do? It's called the artery prostate biopsy assay. That's a bit of a mouthful, but its job is incredibly smart. When a man has a biopsy for suspected prostate cancer, this AI analyzes the digital images of that tissue. It then generates a personalized risk score. Think of it like a highly advanced, super intelligent second opinion for doctors. This score helps them understand the specifics of the cancer far better than ever before. This technology is already making waves in previous clinical trials. It proved it could identify which men with high-risk prostate cancer would benefit most from a specific drug called abiraterone. That's a huge deal because it means getting the most effective treatment to the right person right away, but its potential doesn't stop there. Trials in the United States have shown it can do even more for men with less aggressive forms of prostate cancer. The AI can help predict who would benefit most from adding hormone therapy to their radiotherapy. This level of personalization is the future of medicine. It's all about tailoring the treatment to the individual, not just the disease. The AI can even help identify which patients have a slow-growing cancer and can be safely monitored without needing immediate and sometimes life-altering treatment. This helps avoid the stress and side effects of treatments that might not be necessary. Dr. Matthew Hobbs from Prostate Cancer UK put it perfectly. He said that once this tool is implemented, it could be used across the entire spectrum of the disease, from the least to the most aggressive cases, to make clinically and life-enhancingly important decisions for every single man. That's a powerful statement, and it's already a reality in the US where this tool is widely used. Now, the UK is taking a careful, methodical approach to see if this success can be replicated within the NHS. The new study, called the Vanguard Path Study, will involve biopsies from over 4,000 men. Initially, researchers will use samples from men who have already been treated to see if the AI's predictions match the real-world outcomes for UK patients. This is a crucial validation step. Then, the trial moves into the real world at 3 major NHS sites in Bristol, Oxford, and Glasgow as men go through their normal diagnosis process. This AI will be running in the background. Doctors will make their treatment decisions as usual, but they'll also be given the AI's analysis. They'll then be asked a critical question: if you had this information, would you have recommended the same treatment? This will help researchers understand just how much impact the AI has on real-time clinical decisions, and if it can speed up the time between diagnosis and starting treatment. The ultimate goal here is to strike the perfect balance in treatment. We want to avoid both undertreating aggressive cancers and overtreating slow-growing ones. This AI could be the key to achieving that. For this tool to be officially adopted by the NHS, it needs to prove it's scientifically valid, cost-effective, and genuinely makes a positive difference. Professor Gerhard Adert, who was involved in earlier research, highlights that this real-world NHS trial is essential because what works in a controlled clinical trial can face new challenges in a complex healthcare system. Even the government is excited. The Minister for Public Health, Ashley Dalton, called this research a huge step forward and a demonstration of how technology can transform lives and improve cancer outcomes. It's a perfect example of why investing in a digital NHS is so important for the future. By embracing innovations like AI, we can diagnose cancer earlier, treat it more effectively, and ultimately, improve the experience for every patient. This is truly where technology meets humanity to make a life-saving difference. Thank you so much for watching. If you found this update on medical technology as fascinating as I do, please give this video a thumbs up. And don't forget to subscribe and hit the notification bell for more content like this. Stay curious and stay well.